It's been precisely 2 years since the COVID-19 pandemic affected the world population. Apart from its severe impact on public health and well-being, the chain effect resulted by coronavirus has been a profound disruption, or probably the largest disruption on the education system in the world history. While over than 1.5 students have to be sent home due to school closures, parents, teachers, and school administrators are struggling as well to cope with many unprecedented changes. The lucky ones are able to study online, while for students in many developed countries such as in Southeast Asia, access to future learning is still a major issue which has yet to be solved. I'm Andi Mohamad Sakti, and my recent study has summarized the impact of health crisis on school populations, a study that we'll be discussing in this short presentation. Health crisis is anything which can be constituted by some emergent events, such as devastating infectious disease and natural disaster, whose scale, timing, or unpredictability threatens to overwhelm routine capabilities or to result in certain negative health consequences to community. In some cases of immediate health threats, such as viral pandemic, hurricanes, and tornadoes, the authority will commonly issue an emergency declaration in order to mitigate the impact of the crisis on society, in which the fund, personnel, and all needed materials will be deployed as aids for strategic interventions. An example can be drawn from a viral epidemic case like influenza. Considering a young school-age children as the most vulnerable group to this particular disease, the implementation of school closure has been outlined as the most effective strategy to mitigate this particular disease in many previous studies. Then what about COVID-19? Likewise, this pandemic has also driven a massive transformation in many aspects of educational landscape, particularly when teaching and learning have to be conducted online, moreover in such fields where in-person interaction is requisite. For instance, in field education, in vocational education and training, and of course, in medical education. What more worrying is the effect of this pandemic does not apply partially to only certain systems at school. Otherwise, it is proven to negatively affect the whole school ecosystem, including its main stakeholders, from students, teachers, administratives, to even parents. One of the most highlighted impacts when it comes to discussing the struggle of these populations during COVID-19 pandemic is mental health. A recent study involving university students in the United States found that most of respondents experienced an increase on stress and anxiety due to pandemic and school closure, and the difficulty to concentrate was found to be the second highest factor in resulting that stress. Despite many impacts have been resulted by health crisis to school ecosystem, especially among its population, a systematic review regarding this particular issue has yet to be covered by any previous studies. This study, therefore, will try to summarize the impact of health crisis on school population, which includes students, teachers, parents, and school administratives, by summarizing some key elements such as the type of health crisis, the impact of health crisis, the studied population, as well as the approach used to study the issue. The objective of this study is to map the impact of the health crisis among school populations all over the world. In identifying how this particular topic was studied in prior literatures, an extensive literature search guided by the preferred reporting items for systematic review and meta-analysis reporting checklist was performed in two selected databases, namely Web of Science and Scopus. We decided some predefined criteria for inclusion eligibility to assess the suitability of each article to be included in review process. The first criterion is time frame, which including all related articles within 2 decades from 2000 until 2021. Then the second criterion is that the articles have to be written in English and it has to be research paper, so any other document type such as review, editorials, note, or book chapter were then excluded from the review process. In terms of source, we decided to only include the articles that have been published in journal. Therefore, any papers from conference proceedings, book, or book series are deemed ineligible to be reviewed. Because the selected issue was studied and discussed in social science and hard science area, we chose to include all articles that published in Science, Social Science, and Art and Humanities Index. The search string was developed by including some keywords related to health crisis, impact, and school populations, so that every article which has any of these specific keywords on its title, abstract or abstract keywords will be retrieved by the system. And this is the search string we have used. A total of 457 articles from both databases were included in the actual screening process. From 557 articles reviewed in title and abstract screening, we decided to exclude a total of 391 articles, as there are only 66 articles that have reached others consensus. Finally, the whole screening process decided that there were only 41 articles that are eligible for qualitative synthesis. Our findings reveal that the impact of health crisis on school populations have been studied in several countries such as China, United States, Spain, Italy, United Arab Emirates, and many other countries, and most of them were studied quantitatively. The findings also summarize that there were 29 articles which discussing the impact of COVID-19 pandemic on mental health, 14 articles on teaching and learning, 20 articles on quality of life, and only 1 article on physical health. Mental health appeared to be the most prominent impact of health crisis among school populations. And interestingly, all 8 studies originated from China, and 1 comparative study involving China and Hong Kong population were consistently outlining the impact of COVID-19 on student mental health. This finding reflected the mental health emergency in China, especially in the earlier phase of the outbreak. Therefore, this study is expected to be a reference for future works in formulating crisis mitigation strategy to reduce the impact caused by health crisis on school by taking some context applied in each type of crisis and its impact into considerations. That's all from me, and to end this presentation, I would like to extend my sincere gratitude to all of my co-authors, which are also my supervisors and my biggest support system, to Associate Professor Dr. Emma Mohamad, Dr. Arina Anis Azlan, Madam Siti Zaiton Mohamad Ajis, and UNICEF Malaysia. Thank you so much. This research could never be done without your outstanding support. That's all from me. Thank you so much and goodbye.